And in the past, especially when you first started working with menopausal patients, were there any hard lessons you learned early on that kind of helped you now?
I think that, um, not necessarily specific to menopause,
Okay.
but in general, that it wasn't necessarily a hard lesson for myself, but as a member of the healthcare community, the, healthcare trauma that some people have experienced and the lack of empathy and the lack of understanding in healthcare, I'm sure I was not as good with that stuff when I first started, but also just in general in healthcare, we're not taught that.
Right.
Um, and I think that learning how many patients have suffered through bad interactions with other people in healthcare that then limit their ability to really open up to their doctor and be honest, which then, I always say to a patient that there are very few things you need to see the utmost top specialist in any field. There are a few things like that, but most things, you need a doctor that you're comfortable with, that you can talk to and be honest with. Because just because I give you a suggestion, if it's not right for you, it's not right for you. Just because it's right for someone else doesn't make it right for you. And if you can't be honest with me about your comfort level in a certain option or your history or any of those things, then it's not right for you. And when we don't recognize people's previous interactions with healthcare and other healthcare workers, that we don't acknowledge that they may have had trauma or uncomfortable situations in the past, that the options I'm providing aren't the right ones, and I have to be open to exploring what other options are better for that individual, even if it's not what I would generally recommend to somebody else.
Mm. Wow. How do you think? Obviously, the information when you started your career is different now, and at least, and then the availability of it is different now. How has your philosophy changed on patient care over that time, um, or has the philosophy changed at all?
I think that's one of the biggest parts of the menopause care, to be honest, is that, when I was going through training, we were not taught menopause care.
Mm.
I'm a urologist, traditionally urologists aren't who would manage menopause anyway, but in general, we were coming through training at a time where people were scared inappropriately, by, the Women's Health Initiative study that preemptively, published information in the popular media, really, that scared people out of using hormones, and it really, changed how doctors were trained. And while urologists didn't traditionally do this, even gynecologists or primary care doctors were pretty much taught not to use hormones. They were calling patients, and telling them, stop your hormones, throw them out, don't use them. And then, even as some of that data changed, there was such a bias about it that it really became more of a training in, well, if you don't have to, don't use it. But if you have to, do it this way or that way to minimize risk. And we didn't focus on helping the patient and what they needed and the risk we were causing by not managing this stuff. And I
Yeah.
think that thankfully we've reached a time where people are starting to be aware that it's not just about minimizing risk by not providing hormone management for those that want it, but we are actually increasing the risk by not providing it. And so,
Mm.
um, there are so many benefits to this type of healthcare, physically and psychosocially, that it's not, when we say first do no harm, it's not, we're not limiting harm by not treating them. We can be causing more harm by withholding treatment or not informing people about their options. And I think that that's something that's completely changed in the course of my career.
Wow. Was there anybody, or is there anybody that you continue to follow or talk to or listen to that has both inspired you and influenced you and what you're doing?
There's a lot of great people out there. People that I've met personally, people that I've just read some of their information or listened to them at lectures. I did a lot of my training with a woman named Heather Hirsch, who I know everybody knows out there in social media. She's out there putting out great information. There's other great women that are urologists, Kelly Casperson and Rachel Rubin, who are urologists also, which again, this is kind of newer that we're taking on some of this care, all who provide great care to their patients, as well as out in the media and out and working with the FDA to help bring this care to more women in a safe way and through proper education. Avram Blooming, who is also who's written a book, Estrogen Matters. That's a great book, especially for women with breast cancer who are going through menopause. So those are all people that I think are out there. They're out on social media, and I think that they are smart um, um, physicians, not just social media stars. And I think sometimes that's the hard part nowadays is that we see a lot out on social media, but we don't always know who are the people that are just influencers versus the people who actually are educated and are experts in their fields. And those are people that I think really are more experts in their fields who also have a social media presence as opposed to just, lay people who have a big audience.